All right, everyone. My name is Lawrence Kinnaman. I am the host of the Equity Circle podcast. Excited to have two guests back that we've had on previously who have been very helpful and are excited to have them on. So, Dr. Beth Harvey and Dr. Maria Huang, welcome to the podcast again.
Thanks.
Well, of course. So, why don't we just kind of get straight into it? We wanted to kind of have some follow-up questions of some things that both of you have shared that you've said that you've heard there are common concerns or things that are going on as you're discussing the vaccine. So I'll start with Dr. Harvey first. One of the concerns that is brought up is around puberty and fertility concerns. So I'm wondering if you can address those for us.
Sure. That, of course, is one of the most common questions we get. And as people who care for people going through puberty and people who have parents who would like to have grandchildren someday, obviously, it's a very important question. We actually hear this kind of rumor anytime there's a new vaccine. It's really a common one. And HPV vaccine, it was very similar. So we do know that a lot of these originate from some anti-vaccine people. It's a way to scare people and really make them nervous to give something. Sure. So the main thing we'd like to say is we know it does not affect fertility. They've been following pregnancy data. They've been looking into very detailed scientific data. Does this go into an ovary or does it go into a sperm? And the vaccine doesn't. It doesn't work that way. They're two separate systems with reproduction and your immune system. And so, we think originally it was sort of some science that got theorized that there was this little protein that perhaps your immune system could react to that's in the placenta that's sort of similar to the spike protein, but it's basically like so non-similar. It would be like as if your area code was the same, but your phone number was not. So it's like a little snippet of similarity that doesn't make sense that it would cross-react. And I think it's a fear tactic that people do a lot with science, is they try to give you this very minute scientific detail, but where theoretically might make sense, but if you're actually talking to the scientists who do it, it doesn't make sense. So, and the other thing I always say too is if you're really afraid of fertility issues, you should be protected from COVID, because we know that COVID actually can do some things that impact fertility, especially male fertility. And then for pregnant women, it's very dangerous and they can be, in the ICU and hospitalized, and thus affect the safety of babies that way too.
Yeah, is there anything you would like to add, Dr. Huang, to that?
Yeah, I would absolutely agree with everything Dr. Harvey said. And then just to touch on the concern for puberty, since we're talking about the 5 to 11-year-olds, again, also totally untrue that this would cause a problem with puberty. In the 12 to 17-year-olds, we've seen over 7 million adolescents receive this vaccine. And some of them were going through puberty or had, started puberty when they got the vaccine. And there's been no evidence that this affects any part of their puberty. So and I would just add too that the American College of Obstetrics and Gynecology strongly recommends this vaccine to all women who are thinking about getting pregnant, who are pregnant, who are breastfeeding. So it is safe and strongly recommended.
Well, one of the next question that I have is something that I know that I've heard, and more so maybe around adults, saying, I've had COVID. Why should I get the vaccine? I know for me personally, I had COVID, and that was one of my questions before I got vaccinated. And obviously over time, I've seen time and time again how important it is to get vaccinated, and how for those that have had COVID, you can get it again, and especially if you're not vaccinated. And so I know for me personally, this is something that I had questions about, but then answered, over time as I got vaccinated. So question is start with you, Dr. Huang. My child had COVID. Why should they get the vaccine?
Yeah, this is a very reasonable question to ask. And, we know that almost 40% of 5 to 11-year-olds in the US have had COVID. And we know that the protection from the infection, also called natural immunity, we know it wanes over time, maybe protection for 3 months. We don't know for sure, but we know that it's not long lasting. And then we know that natural immunity also just protects against that variant that you were infected with. So let's say a 6-year-old was infected with COVID in February of 2021. So that was when the Delta variant wasn't circulating. And so, yes, they had protection from that variant, but they wouldn't have protection from the Delta variant, which is 99% of the cases we're seeing right now. So, there's benefit to the COVID vaccine because we know that it can protect against a number of variants. And then natural immunity, again, because it only protects against that variant, doesn't protect against reinfection, which we know also can happen. So there's a lot of benefits to the vaccine. And we know that if you've had COVID and then you get the vaccine, then you have an even stronger immune robust response. And then also, we know that 5 to 11-year-olds, when they get the COVID infection, it's usually mild, or they're even asymptomatic. So with that, then we know that robust immune response isn't as strong as if someone had severe infection. And so, the protection from natural immunity is probably not that great. And again, doesn't protect against reinfection, doesn't protect against other variants. And sadly, because about a third of the world's population is vaccinated, only a third, the risk for more variants is rampant. And so getting the vaccine is just so important, whether you've been infected with COVID or not.
Sure. So it sounds like there's a lot of reason to get the vaccine, even if someone's child has had COVID, as kind of an additional protection, because we don't know how long the immunity lasts with natural immunity. Is that kind of what you're saying?
Yes. And, with the COVID vaccine, we know that protection is at least 6 months, probably up to a year. Whereas with natural immunity, it's maybe 3 months. And again, only against that variant.
Got it. Dr. Harvey, is there anything you wanted to add to this?
And I think the only thing I would add too is I have had some patients who did get that original round with the alpha variant and then got Delta again. And it doesn't, just because you've had it doesn't mean it also guarantees that you won't have a severe infection the second time. I feel like I've seen a lot where alpha was okay, but Delta, they got really sick. And so there's just no way. I think the safest way to protect yourself is to get that vaccine. And it's almost like I saw it described as like super immunity when you have had the infection and then you get the vaccine. It's even better. So it's really not that I want you to ever get COVID, but if you have had it and you get the vaccine, it's very protective.
Thank you, Dr. Harvey. And this next question is actually for you. I know this is something that is brought up often. Is what about the unknown long-term side effects of the vaccine and not knowing that? I wonder if you could speak to that and sometimes the concerns that people have regarding that.
Yeah, I think anytime you do something new, it's always scary to think about the unknown future of how is this going to impact us. And when you talk to the people who research and develop vaccines, if you have an unusual reaction to it, it should be within 6 to 8 weeks of giving the vaccine. We just don't see like 3 years down the road, you're going to have this happen. And they've studied that with, all the old traditional vaccines as well. And this is not a live vaccine, it's a killed vaccine. And so I think we can say very safely, if if you have, with the millions and millions of doses that have been given, we know essentially what probably the main weird, unusual side effects are going to be, and they should be within that 6 to 8 week window.
Thank you. And Dr. Huang, is there anything you wanted to add to that?
Yeah, I would agree. And it's just really important to remember that probably, hundreds of millions of people have gotten this vaccine, and it's been out for almost a year now. And so we haven't seen any kind of long-term side effects thus far. And, over 7 million 12 to 17-year-olds in the US have gotten it. Close to 1 million 5 to 11-year-olds have gotten it. So, the safety profile so far is excellent. And as Dr. Harvey said, in the history of vaccine development, we haven't seen any long-term side effects beyond 3 months with any vaccine in our history.
Well, I want to thank you both for spending some time to answer some very common questions surrounding the vaccine, and especially some of the things and concerns that you see in your clinics as well. So as we come to a close today, is there any final encouragement or things that you would like to share with our audience today? I'll start with you, Dr. Huang.
Sure. Again, I mentioned last time too that we are pediatricians. We care about kids. We would never, recommend anything that we wouldn't do for our own children. And as I mentioned before, my 9-year-old has gotten her first dose of the COVID vaccine. And then just finally, I think all of us want this pandemic to end, in our state, in our country, in our world. And really, COVID vaccine is the safest and best way for us to get back to a sense of normalcy. So I urge you to consider not just the health and safety of yourselves, of your children, but your entire community, because we all want this to end.
And I would just say in closing, we had our first mass 5 to 11-year-old clinic last weekend, and I was on call. It was fantastic. It was people crying and celebrating and being so relieved that they'll be protected by the holidays. And when I was on call last weekend, I got 0 calls with any reactions. And we prepared them that maybe they would be a little tired or headachy or sore arm, but I didn't get a single call about a fever or any other reaction. So far, kids are tolerating it really, really well. And so I want to reassure people about that. And then also thinking about the enjoyment of holidays and how we protect each other and how we miss being together, and how this is one more way we can be celebrating together in a safer way and not having to necessarily wear masks if everybody's protected. And again, I'm just starting to think about those in the community that can't be protected. So we're starting to see more babies that are getting exposed again, and postpartum moms, and we're starting to see our vulnerable, like I've had one of my patients hospitalized this week with COVID who has an underlying health condition and got exposed. So before he's the age he could get the vaccine. So that's what's sticking with me is and I feel like I'm seeing more COVID again this week. I'm a little worried it's going the wrong way. So I want to get everyone protected as soon as possible.
Absolutely. Well, it is encouraging to hear about how the first clinic, the mass clinic, went at your office, and being able to see that. Of course, we encourage people to get vaccinated, just like you said, Dr. Harvey, just to make sure we're protecting those that are unable to get vaccinated, and continue to keep us safe, especially as we come into the holidays. I know today we're recording this. It's on November 16th, and we're very close to Thanksgiving. So I want to thank you both for your time and for sharing your thoughts and insights. We really appreciated it, and all that you've shared with us. I want to thank you, listeners, for listening to another episode of the Equity Circle podcast. Please make sure to share with friends and family and subscribe. Leave us a review and help others find the podcast. And lastly, remember that equity equals progress.